Hey, rock star, what's going on?
How are you? How are you? I am on my phone.
Okay.
Uh, I can't find you on the computer. I can't find your email. It's not
What?
working. And I've got your email
Rock
today.
star, what's going on? Sorry.
So we are here. I'm happy to be here.
Me too. Me too. I this is fine. You're lovely in this frame. I just you're lovely in any frame. So I had something come across my desk today, because Alyssa forwarded it along, and at TVCCA they're looking at they're in the area. We got Haitian immigrants. We know that that's the population that folks are starting to serve. And I know you. I know I'm never enough about what you do and whatever, but like for the listening audience, right? What who are you and what's your relationship to the Haitian community? And what uniquely positions you as someone who can be a part of the solution in closing the gap between what the Haitian refugee community needs and the resources that are out there?
Who am I? I'm
Yeah.
active in my community. That's who I am.
Well, you're
I'm
Cynthia
awake in the
Jean-Marie,
things that
right? Like
I do.
you don't,
That's
you're
who
all
I am.
business. You don't even,
I'm
names don't
active.
matter.
So you want me to introduce myself,
Yes,
Cynthia
introduce
Jean-Marie,
yourself.
community health worker in the state of Connecticut.
Yes.
Um, I work with different communities, underprivileged communities, youth
Yes.
communities, Haitian communities, seniors, people with disability. So I work with a lot of different people,
Right.
you know. Right here, right now, today, we're talking about the Haitian community. So, who am I to the Haitian community? I'm the person that comes in and brings resources,
Mhm.
talks to stakeholders in regards to some of the what's happening within our community. What are the what difficulties our people are facing in Connecticut? So that's who I am. That's what I do.
Nice. And how long you
And
been
that
at this?
all my life, how long
I
I've been
know, I
active.
know.
I was born into this. Like
You're
you said
telling
in the
me,
beginning, Ian, like you said in the beginning, you don't know
yeah.
much about me. I was actually sitting down the other day and just reflecting. And I remember at the age of about 8 years old, my grandmother had to go to the local hospital, Backus Hospital. They
Okay,
found a tumor in her breast and they wanted to remove it.
sure.
Now, she didn't speak English. Guess who was her translator? Me.
That's right.
They took me out of school because I couldn't stay in school. Like I was going to Sacred Heart School here in Tathville, and
Okay.
I was crying and crying and crying. And they asked, "What's the matter?" I said, "My grandma's in the hospital and she doesn't speak any English. Like
Yeah.
if she wants water, nobody will get her water." So I got a free pass out of school to spend my days with my grandmother so I could translate for her in the hospital. So when
And
I tell you I've been doing this all of my life,
right.
it's not a joke. This is all of my life. I've been a caretaker, a caregiver, you know,
A
a
medical
health worker.
interpreter, even though unofficially, right?
So all of this is part of me. I'm a certified medical and community interpreter, by the way.
Yes. Oh, I know
But
you.
yeah, but um, when I tell you this is who I am, what I am, it's the truth. There's no need for a name anymore when you know what you were born to do, what your purpose on this planet is.
Hmm.
You're just active for the people. I'm active for the people. That's what I've done all my life, and that's what I know how to do. And I try to excel at it. And I try to collaborate with people like you. I meet people like you along my journey,
Yep.
that I love to support and to inspire and motivate and say, keep going. What you're doing is important. You're reaching the masses.
Thank you.
You're
I,
reaching the masses.
I'm only important because of the people that I know, and I'm blessed to have you in my life too. But it's important that people know that you're out there. And so what are the ways in which you manifest that your goodness, that your blessings, that your gifts manifest nowadays, right? So we've got your elder care, we've got the Greenville Project. Go ahead. Don't let me
So,
talk here.
how does my work manifest today? So
Yeah.
we have Circle of Health Home Care. Circle of
Hmm.
Health Home Care is a non-medical home care agency here in the state of Connecticut that provides training for home agencies. We also have Care for Life, which is a home care agency. Subcategory, sub department of Circle of Health. In the state of Connecticut, we had to change our name last year to Circle of Life because we couldn't have the word health in there. So
Oh, I see.
we don't only train, um, provide training for home care agencies, but we also provide the service. And the
Hmm.
people that we provide the service to are the difficult cases, the hospice cases,
Hmm.
people with difficulty transferring that might have disabilities like MS, cerebral palsy, where their body is changing, actively changing over time. So these are the clients that we typically take care of, those in their home, in the privacy of their own home. They don't want to live in a facility. They want to live in their home where they grew up,
Right.
where they were
Where it's
raised.
comfortable. Yeah.
Exactly, where you feel safe. You feel
Right.
safe in your home. You know what I mean? So I'm that person that you call on when you want your loved one to die at home, when
Yeah.
you want your loved ones to live out the rest of their life at home. My
Uh-huh.
cat is going
You
crazy.
you're a visitor. What's your kitty's name?
I'm sorry, you got to visit her on the show.
I
That's
love it.
Luna, Looney Poo.
Hey, Luna.
Yes, she's
Looney
Luna when
Poo.
she's nice and calm. She's Looney Poo when she's doing this.
When she's
Okay,
like,
she's a lunatic right now. Sorry. I'm kidding.
nuh-uh. That's great. I love it. Hey,
And
Looney Poo.
you see,
That's
she knows she's
outstanding.
not supposed to climb on the furniture and stuff like that. So I'd be
Uh,
like, Looney Poo. That's when she's acting crazy.
isn't it?
So,
You know,
what?
you teach virtually as well. You teach CHWs and whatnot. Don't the people around you kind of act the craziest when you're on camera? You're like, "Ooh, I can't even with you right now because like we're restrained. We have to restrain ourselves." I had I had two interruptions while I was teaching today. I taught for 6 hours, 6 hours of CHW, one cohort in
Ooh,
the morning, one cohort in the afternoon. Yeah, for CRT. And I'm just like, each one, someone pops in here. First one's a 12-year-old little girl. She's like, "Where's my tablet?" I'm like, "Where did you look?" Like, get out of here. And then the second one was my partner, my girlfriend. And I'm like, there's nothing more sacred to me than my camera time, my work time, my teaching time.
mhm.
I'm just like, please do not. And they
Just
just can't get it. But boundaries was the point I want to get to here, right?
yes.
And so in the cohorts that I was talking to today and working with for the first time today, a lot of questions come up like and but thematically was this concept of boundaries. How do you stay within the bounds of your work when you know that just outside of the bounds of your work is this little thing that you're being asked for and it's not too much to give at the individual level, but it's not ethically appropriate, right? um the idea came up around, for example, medical transportation, right? I had to coordinate medical transportation for people who were, maybe 5, 10 miles from care, and I couldn't help them register their car. I couldn't help them um, get boots, right? I couldn't help them get a bicycle or anything like that. I couldn't help them renew their license, right? These were all the constraints that were placed on me
Yes.
from the funder. But what I could do, what I was allowed to do, was set up an Uber Health for them,
Mm.
right? Talk about a band-aid solution, right? And so those, those dilemma moments, those conundrum moments where you're like, I can do this, but I'm supposed to do this.
Mhm.
and what it means for the individual and what it means for the organization to make the ethical decision. Like you might lose your job, the organization might look bad, things of this nature. So, how in that work, especially with it being so intimate, do you maintain clear boundaries?
Everything that I do is interconnected.
Yeah,
It all has to do with community health. Whether I'm working with a Haitian family or an 85-year-old person with cerebral palsy,
right,
it all has to do with health. Health is what I tell my children. Well, your health is not just your medication or your doctor's visits. We just said it. You feel safe
right.
at home. You feel comfortable at home,
Hmm.
right? So that's health.
Yep,
You were just talking. How do I get this person to their doctor's appointment? Transportation is health. That's
right.
part of health. Having living, in an area where you have access to produce within a 10-mile radius is health. Living in a community where you have access to medical services within a 10-mile radius is health.
Right.
So everything that I do is related to public health, making our community stronger and healthier. Whether I'm community building with the Greenville Neighborhood Committee, bringing stakeholders into the community to do outreach and to connect with community members, with family members,
Yep.
or I'm doing individual capacity building where I'm working with clients on an individual level, saying, what are your goals? Where do you want to go? You're 85 years old. What are the things that you want to do at 85 years old?
Hmm.
No longer able to walk in a wheelchair, but you still are seen. You
Right.
still want. It
Hmm.
doesn't stop. Health never stops. Us wanting to be happy or joyful never stops. Us wanting to be a part of society never stops. So
Hmm.
there's no boundaries in being a human being. So I
What's
work with
that?
people on the human level.
Right.
You know, when we work with organizations, yes, we have boundaries, we have rules, there's grants that we work with, and I get frustrated working with my grants. I'm like, this is what we want to do because this makes sense for the people.
Right.
This is what the people want, this is what the people are asking for. So that means that we have to sit down and be creative. There's no
Hmm.
more cookie cutter. You see what I mean? For example, I have a block party that I organized. This is our fourth year. And the first year, I told our community partners, bring an activity to do. And
Okay.
everybody's like, what? What do you mean an activity? I don't understand. We usually just bring our information in the table. What do you mean bring an activity?
Hmm.
Bring an activity to do. We had, what is it, senior resources
Okay.
out with a checkers table, like checkers,
Love it.
okay,
Love
playing
it.
checkers with the kids, all right?
Yeah.
We had the health education center with an axe throwing.
Hmm.
So now you make it engaging.
Right.
You make your booth, your outreach engaging, where you're not just standing behind a table with a whole bunch of papers and people are coming and like, oh, what are these papers all about? You're
Right.
on the other side. You're
Yep.
saying, let's throw some axes. I'm from the health education center. If do you want to learn how to, if you're bilingual, we can teach
Right.
you. We can get you certified to be a medical interpreter, right? You know
Yep.
how many more people are coming to the table?
Right.
Their kids are playing axe, so now their kids are not bothering them, and they get to listen,
Right.
and they get
Exactly.
to remember that interaction
Yeah.
that you came to their community, brought resources, was down to earth, played axe
Hmm.
with them. When they see you in the grocery store, they're gonna say, "Hey!"
Right. Right.
So that's who Cynthia is. That's
Yeah.
working with our grant money and making it more human.
Right.
What do the people need? Let's get down to
Yeah.
the people. We're here for the people.
That's it. We
So
see the human before the need. Yeah.
so even though our grants might have some boundaries, our organizations might have some boundaries, we have community partners. We're
Right.
no longer working in silos.
Yeah.
That doesn't exist after COVID.
Uh,
After COVID, we learned that if we work together and we combine our resources, that's what we learn, that we're stronger. We have a better and healthier community. So I'm loving it. I'm absolutely loving it. I'm loving the fact that I'm able to now to work as a community health worker on all different levels, on
it's
all
beautiful.
different levels. Individual
Yeah.
capacity building, case management. Um, Even every 3 years, we do these assessments for the hospital and public health. We're
Okay.
pushing this information out into the communities and saying, "Hey, fill out this survey. This survey is for your local hospital. How your local hospital can serve you."
Yeah.
You know, and being a part, being able to see that full circle when those health assessments have to be done. The city,
Hmm.
the hospitals are required every 3 years, and your city is required every 10 years.
Okay.
To do a survey on the community and see what the community needs are,
Right.
the
That's great.
demographics of the community, what the community needs are. So we just did
Hmm.
Hartford Health Cares, and the outcome for that, and watching them actually put into action.
Hmm.
We have languages. Polish is like number 2 language in the area. Who would have
Right.
thought?
Who knew? Who knew?
we need
Where are
some
my
we
Polish
need some
medical
Polish
interpreters? Let's
translators.
go. Yeah.
We need some Polish interpreters. You know, Haitian Creole is number 4
Hmm.
in the area. We all knew that, but it's like the things that you're surprised about, you
Yeah.
know? And it's like, okay, now we're seeing our, our local hospital changing, investing in changing
Hmm.
their interpretation, the company, their third party that they use,
Yeah.
making it easier for patients to communicate with them. They're asking for feedback. So this is what the community health work is all about. Going
Right.
out there and seeing it, I've been blessed and highly favored to see it full circle,
Hmm.
to see all the different players, to be a consultant with Hartford Healthcare, to be
Yeah.
a community member, to also be part of or be a stakeholder, that's
Hmm.
working with their patients, you know,
Right.
to be out there promoting and doing outreach for these community assessments, talking to people, helping them, do the survey, developing the survey with Hartford Healthcare,
Nice. Nice.
you know, and then
Yep.
seeing the outcome, so I think as a community health worker, we have to not think of being in a silo, but
Hmm.
connecting, networking
Right.
with our community partners.
You know,
I don't know what else
you
to say.
you are an absolute ray of sunshine. I wanted to know, and because I think there are people out there who are less connected. Obviously, there are people out there less connected to the Haitian community, right? But what are the particular stressors that you're seeing impact our immigrant families?
Fear.
Okay.
When we talk about stressors, we could talk about everything, but when you are afraid to step outside,
Hmm.
you're afraid to go to school, you're
Right.
afraid to go to work, you're afraid when the door knocks,
Right.
you're afraid when you hear a siren outside.
Yeah.
Living in fear I believe, is the biggest problem in the Haitian community. Not
Right.
only the Haitian community, we have to say in the immigrant community.
Oh, I would agree.
I represent the Haitian community. Yes, I'm close. I'm very close. I'm first generation Haitian American,
Hmm.
um, ingrained in Haitian community. However, this is not just a Haitian problem.
Right.
This is a Dominican problem. This is
Yeah.
a Haitian problem. Indians from India are our largest immigrant population.
Hmm.
It's an Indian problem,
Right.
you know. It's a Ghanaian problem,
Mm.
South African problem, Chinese problem, Japanese problem, because these are all immigrants in America.
Right. Right.
So, yes, I can speak to you about the Haitian community and how it's affecting the Haitian community, but fear has no borders. It
Right.
has no nationality.
Hmm.
When you are afraid to step outside your house, that is real. It has
Yep.
nothing to do with being Haitian. It has something to do with our our society now is changing. There's some
Yeah.
things that are happening that are changing around us that we do not understand. And we don't when you don't understand something, you're afraid of it.
Yep.
Even me myself, I've sat down with other Americans.
Right.
Okay? I'll pull out my passport for you.
Right.
You know what they're telling me? They're walking around with their passport. Okay? That's
Hmm.
what they're doing. They're
Yeah.
walking around with their passport because
Oh,
Americans are being stopped.
right.
Even
Exactly.
Americans, yeah, even Americans, US citizens are being arrested by ICE and sent away. And
Yep.
like this is
Yep.
what we're hearing on the news
Right.
that this person is legally here, this person is a US citizen, but
Right.
for some reason, some way, somehow, something in their resume, their repertoire, or whatever
Uh-huh.
the word is, has put them on the list
Oh,
and they're
yeah, the
getting
profile. Right. Yeah,
yeah,
yeah.
and they're getting outed.
Right.
So when we
And
talk about the Haitian community
yeah.
right now is an immigration problem. It's that's facing America, the
Hmm.
American community. It's an immigration problem that America is facing. And with that immigration problem that America is facing, you're going to see issues with our workforce.
Yeah.
The people that go to work are the immigrants. They're not eligible for any assistance.
Right.
Okay.
Right.
So the people that are going to work that are ineligible for any type of assistance are now under attack. What
Right.
does that say about our workforce? What is going to happen to our organizations in the state, our large organizations in the state? Uh, about 4 or 5 months ago, I heard that Lowe's
Hmm.
factory had let go of 70 people. 70 people.
Oh,
How can that organization function with 70 people overnight gone
right.
because of their immigration status?
Uh-huh. That's wild. It is wild.
So what does that say for for me? I go I'm like on a gerbil wheel, because I see the whole picture.
Right.
So this company that pays taxes to the state, local taxes, people that work there are paying rent. They're
Hmm.
going grocery shopping locally,
Hmm.
they're and going to the gas station locally. So
Right.
now you have
Every dollar they
70
make is going back into the community. Yeah.
communities. So
Right.
now 70 people
Hmm.
aren't able to pay rent. That's
Right.
70 apartments, 70 landlords that are going to have to go through eviction in 3 months
Right.
that are losing. So it's not just the 70 people that lost their jobs.
Oh, it's a ripple
Now
effect.
you're putting the
Right.
livelihood of the landlords into
Hmm.
into property owners into effect.
Hmm.
The local stores, you know, that depended on these people to stop for gas, on their way to work, on their way home from work.
Right. Right.
It's a ripple effect.
Yeah.
So that we have to look at, and it's stress. It's stress. The stressor is, yes, definitely in the immigrant community, but you're
Sure.
gonna see that stress start rippling, start rippling.
Hmm. That's
you
it.
know and that's what I want our community health workers to think about when you're
Right.
sitting down at the table with the stakeholders, with other companies, and saying, yes, we need to work together to keep our immigrant population secure, keep them employed.
Hmm.
I see a lot on the ground where our social service organizations, God bless their soul, they
Hmm.
have put signs in place. They put trainings in place on if ICE comes in here, what to do. They have lawyers
Hmm.
on speed dial,
Hmm.
because they're serving that population, that immigrant.
Right.
They know that the population that they're serving is undocumented
Right.
or under
Right.
documented.
Hmm. And it doesn't matter the burden of proof when it comes to ICE. The burden of proof is on you. ICE is going to come scoop you up. You don't have your papers on you. Well, you have to prove that you're a citizen, or you have to prove that you're here legally as a refugee. Yeah,
Yeah,
it's
you know.
what a mess.
I'm sorry, my cat just scratched me.
No,
Luna,
it's okay.
she wants some love. I'm
She
gonna put her out.
does. You love your cat. I'm not trying to stop that. I'm not going to get in that way. I know. I know. So that's a short hair. I had a black long hair when we were
Yeah.
getting trained to CHW together.
I'm sorry.
What are you sorry for?
She is no longer invited to the meetings, to
No, no.
the podcast.
Hey, we have to raise each other. It's okay. So,
Um, Speaking about the Haitian community,
yeah, please.
Norwich has a large population
Hmm.
right here in Norwich, Connecticut. The population, because of the population of the town and the amount of Haitian immigrants that are in the town,
Yeah,
you know, um, those are the things that are concerning because our population is growing in the town. We don't have enough jobs to support them. We don't have enough homes to support them.
right.
Um, but we do have a strong network of social service agencies. You name
Right.
TVCCA. We have Rose City Learning,
Hmm.
Otis Library,
Yep.
Lead, Mosaic,
Nice.
Madonna Place.
Yeah, I was about to say.
So we have a lot of organizations, Hartford Healthcare,
Right.
Generation, UCFS.
Yep.
They are working together and supporting the community, supporting the Haitian community with legal work, with legal support.
Yep.
JFS is moving. The Jewish Foundation is opening an office here in Norwich. They
Oh, okay.
have a psychotherapist. They just hired a therapist, a Haitian therapist, to work with the community. They're looking to put
Oh,
some
lovely.
programs inside the school to work with the children
Great.
um, that have been affected. So this is all stuff that's going on the ground. So when I tell you we have a very strong social service backing in this community, for
Hmm.
the Haitian community, I'm so proud. I'm so
Yeah.
proud because it's not like that everywhere else.
Mm. No,
And
this
I'm
is true.
learning. And I'm
Right.
learning because we can take what we learn here, what our organizations are doing here, and bring it elsewhere. When we
Right.
sit at the table and we're talking to other counties, have a meeting with leaders from New Haven County or Fairfield County, and they're talking about the Haitian immigrants. We could say, hey, this is what Norwich is doing, and it's
Right.
successful.
This is what works here. Yeah.
Yeah, this is what we're doing, and it's working.
Right.
you know, Jump on board. We are
Right.
working together. We're using our local library as a central focus point. We're bringing in other organizations and saying, hey, yeah, you have a home here.
Hmm.
We're going to share an office with you. Can you can you imagine that? Like two organizations getting together and like, no, you're gonna come here, put your desk in here, bring your staff in here. This is our
Cohabitate.
office.
Right.
Yeah, they're there's no more silos.
No.
You find you go into Rose City Learning and you find JFS in there.
Right. That's special. That is special.
That
Like
is
we are in 5 years past COVID, uh, and we're at a very different place in the way that these organizations work together. And I think there's an anti-belonging and othering that's coming down at the administrative level, and yet in the face of that, these organizations are saying, no, no, we're coming together, we're a net, and that's really critical to show our immigrants and whether they intend to be permanent or not, um, they belong here. We want to provide a sense of safety for them.
This
Say it.
this is coming. What's beautiful about this is that I see it coming from leadership. It's coming from the top.
Okay.
Leadership is reaching out. It's leadership,
Okay.
that's reaching out to the community. I just had a wonderful meeting last week
Hmm.
from the head of JFS saying we are coming to Norwich. How can
Beautiful.
we serve?
Right.
Where is our services best used?
Right.
Who
And
do
they're
we need
coming.
to talk to? Who else do I need to talk to?
Exactly.
You know? So
No, that's,
it's just wonderful that leadership because
I love it.
we've never encountered this before.
Hmm.
This for me, I've never encountered this before. It's always been, oh, we do things this way. That's their organization, how they do things.
Right.
Now the organizations are communicating, say, if you're doing this, we're not going
Right.
to double down on what you're already doing great. We're
Right.
gonna do this
Right. So it's complementary
so
as
that we could
opposed
better
to,
serve the community.
yeah.
Yes,
Yeah.
competitive as opposed to competitive. It's
Right.
complementary to each other. So
Complementary.
this organization is work like we have several organizations that does that teaches that does ESL
Okay.
classes.
Okay.
So the community got together and said, okay, we have about 5 or 6 organizations doing ESL.
Right.
Why? Like what's
Yeah.
happening? You know, it's because the list was so much. Like
Right. The demand was high.
every
Yeah.
the demand was high. Everyone's doing ESL classes and they have a backup list. Like
Right.
we're doing the classes, but we also have an overflow
Overflow.
list. So now these organizations get together. Otis Library connects with all of them
Hmm.
and puts together a collaborative.
Love it.
Simple as that.
Love it.
All of us, we're going to take our resources, our
Yeah.
funding, our resources, and collaborate. So now we have organizations that are, doing ESL classes for people who have never been to school. We have
Yeah.
organizations that are doing ESL classes for people that are looking for workforce, looking to get into the workforce. That's what Rose City Learning does. They teach you English
Hmm.
that you can work with instead of
Nice.
just my name is or the house is blue. Because a
Sure.
lot of people were complaining like they're learning English, but they don't care about the house is
Yeah.
blue.
We
You
need
know
the
what I'm saying?
conversational, right? We need the work
Yes.
related, yeah, the really, contextual. I'll learn the rest of that later. I'll figure out how to say I want to paint my house blue later. Yeah.
Yeah. First, can I get a job, please? I want to work. That's what they want to say. I want to work.
Mm.
This is my experience. They want to talk about their job experience, who they
Sure.
are, so it's just beautiful. And then we also, out of all of this this year actually, we don't only have ESL classes for non-English speakers, but now we have Spanish and Haitian Creole classes for non-Spanish and Haitian Creole speakers.
Mm.
So the community health workers, the people in the
Yeah.
so the people within the organization working with
Right.
these clients, these bilingual clients, are
Mm.
able to go and learn
Love this.
basic Spanish, basic Haitian Creole to ask somebody, what's your name?
Right. Right.
Do
Right.
you know that like people are able to get services because they're not able to tell them what their address is, what their name is. They don't, to be able, like, I want to help you, but I need your address. I want to
Right.
give you this box of food, but I need your name. I have to put
Yeah.
your name. That this box went to you specifically.
Right.
You know,
Accountability. Yeah.
I need to take the box home with me. That when they come into inventory, they're like, there's 10 boxes missing. Did you take them, Cynthia? No, I gave them to people. What was their name?
Yeah.
What's their address?
Right. They
What's their
need the
phone
data.
number?
Yeah.
Yes,
Yeah.
we need the data so that we can continue getting funding to
Right.
continue supporting our communities where they're at.
Right. Right.
So,
What kind of resources or support make the biggest difference right now? Like if I'm an organization or even if I'm a family or individual, like what would you say is the best way to give back?
I know this is just a dream, but I'm gonna say it anyways. Housing.
Yeah, housing.
You know it's just a dream. As soon as you heard me say it, you was like, yeah, she's dreaming. Housing
Well,
is the issue, not just for the immigrant or the Haitian population. It's the issue across the board in our community.
right,
It's an even deeper issue for the immigrant population that now is afraid. The 70 people that
right,
lost their jobs are now
right,
going to be homeless with their children.
right, right,
You know, you're going to see extended family taking on people. And then
right.
that extended family is going to have problems. You're going to see domestic violence.
Be
You're
overtaxed.
going to
Yeah,
see,
right.
you're going to see violence because now you have your home and you took in your cousin and your cousin's kids and
Yeah,
those people because they lost their job and you're trying to be a good family member.
right.
Now you're stressed. You're going to see that. So
So,
housing is the biggest resource that we do
yeah,
not that we need in our community. Housing is going to be one of them. Assistance,
sure.
funding for housing, helping landlords, helping tenants pay some rent.
Right,
Second resource that's needed is workforce development and training.
sure.
Working with stakeholders, attracting certain companies to come here to hire,
Yeah,
talking to the current companies that are here and educating them on immigration status.
right.
That, because I feel when the company let go 70 people at once, it was right after the whole news thing that, these people that they're stopping their, that as of like August 3rd, they were stopping their Biden, people who came in through the Biden program. They
Yes,
had
right,
2 years. They had 2 years. They paid for 2 years for their papers for 2 years, and it's being cut after 3 months, 6 months,
right.
1 year. Like people are like, this is not fair. You said
Yeah,
we could have 2 years. I've
right.
only been here 6 months. I've only been here 3 months.
Yeah,
I'm not getting into trouble.
right,
I have a young man that came through the program, and he's like, Cynthia, I came here. They gave me 2 years. Can you imagine? And now they're saying that I'm not going to be able to work anymore. So he stopped working and he went to truck driving school. He said, if I'm not going to be able to work, they're going to kick me out the country anyways. I'm going to learn something that I can go someplace else and do, somewhere else and do while I'm here. I
right.
hope things change while I'm here. I hope things change. I
Yeah,
believe in America. I believe in what you guys say. That you said that you're going to give us 2 years and you're really going to stand on it. I
right,
believe that because I have nothing to go back to. Because for these 2 years, I sold everything that I had. I
right.
left my children, my wife, I
Yeah,
sold my car, you know,
right.
my business is shut down back home so that I can
Yeah,
come here and raise some money to go back home in 2 years.
right, right. All I want is 2 years. I just want them to, you know, stand firm on
Honor,
that promise I was made. Right.
honor their word.
Yeah. Honor their word.
Yeah. So, we have people right now that take it differently. Some people are living in fear. Some people are saying, hey, I have to do something. Because if
Hmm.
I don't do something, I'm going to go crazy. Since I can't work, I'm going to school. So that workforce development and training is
Right.
key.
Yeah.
Um, trans- English as a second language is key.
Yeah.
Being part of those collaboratives, finding out what's going on, who's who, so you can refer people, have quality referrals in the community.
Yeah.
And again, third, but not least, and definitely not least important, okay, is the resources is our social service organizations.
Hmm.
Our social service organizations like TVCCA,
Right.
um, UCFS. It's a
Yep.
health clinic, but it's still a social service organization because they
Oh,
have
sure.
sliding scale.
Yep.
They're doing community health outreach where they're giving free clinics in the
Right.
community.
Right.
Hartford Healthcare, Hartford Health Mobile Hub. That mobile health hub that we get the list of where they're going to be every single month.
Yep.
Very important to share that and say, hey, if you're not,
Fair enough.
because immigrants don't have health insurance, they
Right.
can't get any state insurance.
Right.
Okay. So
Yep.
these mobile health hubs
Yeah.
are important.
Right. Well, but going back to the fear point. Oh, go ahead.
Well, we have what I've done in the past is that I've contacted Hartford Healthcare and connected them with the local churches.
Yeah.
Now, the Haitian church will put the flyers out, will have a space in their community, and they'll talk to the people within their community, say, hey, there's going to be a health clinic in the
Right.
basement of the church.
Right.
So the church promotes it.
Yep.
It's not something we put flyers all over the place and things like that. So now those people without papers and they're sick. These people are sick.
Well,
These people
yep.
I don't know if you can imagine walking from Panama to America,
Oh,
walking from Chile, South America,
right.
me walking around the lake. I'm winded. Can you imagine
Right.
walking 3 continents? South
Yeah.
America, Central
Central.
America, to North America.
I mean,
That's three
Central America is
continents.
not a continent, but right. Right. I feel you. Yeah.
Well, listen,
Land
it's part of
masses.
a
Yeah.
Central America. They don't call it a continent, but it's Central America.
Right.
It's a different piece.
Right.
Is you know what I mean?
Yeah. It's a landmass. Yep.
So yeah, and Central America is not just that Panama and Mexico. You got to include the islands because these people came from the islands.
Sure.
Some of them took
Sure.
boats to Mexico, to
Yep.
a port in Mexico, and then walked the rest of the way. Do you know that the people now is coming out that the people were raped on the trail?
Oh, I know.
Men, women,
Yeah. Yeah.
and children.
They're exploited, right? They're absolutely vulnerable that have no voice, right? Who would they go to? Because they're breaking the law and they get exploited in this ways. It's terrible.
So, a quick recap because the time is on us. I did show
Sure.
up 15 minutes late, but a real quick
Nah.
recap. Um, I think that right now immigration is a big issue in our community,
Yeah.
the community that we live in America. Immigration is a big issue in America. It's a big issue
Sure.
in New London County. It's a big issue in Norwich. Are we working together? Yes. Do we need to continue to work together? Yes. Do we need more resources? Yes, we need more resources.
Right.
Are we doing our best? Yes. Can we do more? Of course. We can always do more. Where
Right.
can we do more at? At the voting poll. So that's where I want to end with.
Oh, okay.
Those who
Okay.
can vote, those who
Get
can
out
vote,
there and vote. Yeah.
get out there and vote. Be
Sure.
active citizens.
Yeah.
Be active citizens because this is going to be a domino effect. You think you're not an immigrant, so this doesn't bother you. You're not going to pay
Right.
attention to it. You're not going to say anything. You're not an immigrant. You don't
Hmm.
know any immigrants. The last immigrant you knew was your great, 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 great grandfather who migrated here from Italy.
Right. Right.
That's the last immigrant you knew. But guess what? You own property. You have immigrants renting from you that lost their job. Now you have no rental income.
Right.
You own a gas station
Hmm.
and they used to come in there and buy from you.
Right.
Now you have less income per month. Can you pay
Right.
your lights?
You're
You
hit.
have a restaurant and
Yeah.
they used to work for you.
Right.
Okay. We know that we have a large immigration population that works in restaurants, in the
Hmm.
kitchen. You know what
Hmm.
I mean?
Yep.
So what happens to those restaurants when you go to dine out for your with your girlfriend
Yeah.
and you can't get your favorite meal because
Right.
they don't have nobody able to cook in the back?
Or it costs twice as much.
Exactly.
Hmm. Hmm.
So a lot for us to think about, and it all boils down to those who can, please do.
Yeah.
If you can make a difference, do make a difference.
It's a,
That's
it is
all I
up to
can do.
us. Right.
You ask, who am I? I'm just someone trying to make a difference. I'm nobody special. People like, oh, Cynthia Jean-Marie, Cynthia, you do this, you do. I'm just trying. I'm the most humblest person on the face of this earth. I got my own issues going on, but
Yep.
I believe that if you want to see change, you have to be the change.
That's it. That's
And
it.
I think Gandhi said that. Be the change that you want to
Uh-huh.
see in the world.
That you wish to see in the world. Yeah.
Yeah. So
Well
I'll leave you with
done.
that. I'll leave the audience with that until next time.
Uh-huh. Well, I want to remind folks of the CHW network, right? The school community that is now live, and I'll be inviting folks to that, but a link will be available in the liner notes here on this episode, and I'll put your email address as well. Is that the best way to reach you?
Sure.
Outstanding.
Yes.
Awesome. And what
Um,
about oh, you didn't say a lot about the Greenville. I know we were talking about immigrants, but um, talking about the Greenville Community
mhm.
Network, is that
Neighborhood committee.
neighborhood? Yep,
Committee. Neighborhood committee. So we
neighborhood committee.
started the neighborhood committee several years back after there was a shooting downtown, and
Right.
our leaders in the community got together and said, "What is going on?" In
Hmm.
bright daylight, lunchtime, traffic everywhere. Two kids start corralling with guns, just shooting a shootout.
Right.
You thought you was at the
Right.
Wild Wild West,
Yeah.
you know? So this came together, and my son was the only youth in the room, and they all looked at him and said, "What is it that the youth needs? What is it that we can do?" And he's like, "You know what? I don't know if this is what the youth needs, but I definitely know that it's hard to hurt your neighbor when you know your neighbor.
Right. Right.
You know,
That
can
is
you
so well
can
said.
you yeah, so he said, let's have a block party. He's like, I haven't seen kids after COVID. We have a park here next to us that we used to walk to. He's like, I haven't seen anybody playing basketball. I don't hear no kids outside.
Right.
And sure enough, we did the block party and our neighborhood is lively. The kids are back outside. That was that fear,
Yeah.
so we had to
Right.
break the fear. We had to break the cycle of fear in the
That's it.
neighborhood,
Yep. Through
and we
action.
had Mhm. We had gun violence, and we had to show the kids, like, no, this is not the way.
Mhm.
Bringing these resources, we bring youth organizations to the space so that parents can sign up because sometimes, with everything going on, parents are going to work, taking care of home. You don't really see what's available out there for your child.
Right.
So we're bringing the resource right into the community,
Yeah.
you know? We're bringing youth activities right into the community. We're bringing health services right into the community. Last year, TVCCA brought their van and a case manager signing people up, doing
Wow.
cases.
I love it. But that's the way, right? Like we need to be accessible. Transportation is an issue for lots of folks. And so coming to them, coming to where the need is, it's a paradigm that I think really started to happen in through vaccine equity and the mobile health hubs. And I'm glad
Yeah,
to see that it's continuing in different ways.
yeah.
Uh, love this.
And then just a little testimony when you say that, bringing it where it's at, because it's hard to get to the different locations.
Hmm.
Last year, this man and his son came to the block party. And the man is a young man, but he had an accident that made him disabled where he can't walk.
Right.
So he's walking he could walk, but he's walking with a cane. He has a back issue, back pain. And he was just so happy to
Mm.
be able to be out there with his son. His son was about 13 years old. He was just so happy to be able to be and interact with his son in
Right.
this atmosphere. And
Right.
then also to get services. He said, this is so great. He's like, I can't go anywhere. He's like, I can't go far. I don't leave my house because of my back. I
Right.
stay in the house, my back hurts and stuff like that. So he's like, this is great that I could
Yep.
come out with my son and just sit down and enjoy this. Enjoy him having fun. His son won the pizza eating contest. We did a pizza eating contest. His son won.
All right.
We did musical chairs, and he's there rooting his son on. Like
Mm-hmm.
he was just so happy to be that dad outside with his son. Just like I can't take you to the fair. I can't take you to a carnival. But
Right.
here's this event that's happening right here in our
Mm-hmm.
neighborhood. You're having fun. I'm having a good time. He forgot he was in pain for that
Yeah.
moment.
Right.
You know, he was
Right.
just dad. He was dad. You know
Yeah.
what I mean? He was the man, like, dad, look at this, dad. And he's walking with the cane and he just bright face. He said, thank you. Like, he stopped me so many times, just like, thank you. You don't know. He's like, since my accident, I haven't felt myself. I haven't been able to go out and do anything. Thank you.
Sure.
Thank you for this. So, what we
Oh,
do
can't beat that.
is reaching the masses, helping them one by one.
Right
You
on.
know, if I could help one person, I don't need to help a million, but if I could help one, I'm happy. I sleep better at night.
Well, I know you've touched more than one life, and so I'm glad you sleep well at night. Oh, it's just such a blessing to know you, to be able to have you on Orbs. We've been talking about it for months, and that this could finally happen. I I'm blessed to know you, blessed to have you in my life.
Thank you. Same here.
Thank you.
All right.
All right. Well, that is the cast. Talk to
Until
you
next
folks later.
time.
That's right. You're coming back. You know you are.
Anytime. You know me, I love to gab. I'm full of ideas.
Hmm.
This brain, I don't know, what's gets downloads all the time. You People have to
Yeah.
stop me. People are like, Cynthia, please relax.
Enough. Right.
So on Orbs, real quick, if I could do a
Yeah,
little
yeah. No, please.
September 7th, Greenville Playground, 266 Central Avenue in Norwich. We're having a huge block party. I don't want to say this is our last year, but this is our last year of funding.
Oh,
Okay.
okay. Okay.
So we're going to be looking for some more funding. We're going to be out there
Hmm.
knocking on doors to stakeholders and saying we want to do our block party next year.
Right.
So this year we're doing it big.
Okay.
We got the obstacle courses. We got some
Ooh.
carnival games. We're bringing our community partners. Health Education Center is
Oh,
going to
I
be
love
there
it.
again. Yeah.
Can't wait.
So come on out and
Yep.
support. Come on out and support. It's Sunday, September 7th from 12 p.m. to 5 p.m. Music,
Yeah.
musical chairs. We're doing pizza eating contests. We're doing it all
Mm,
this year. We're doing
and on
jump
that.
rope. We're teaching kids how to jump rope. The first year we're
Yeah.
teaching kids how to jump rope. People don't know how to jump rope.
Not
You should have
anymore.
seen
Now
the
kids don't
adults
go
who
outside.
jump rope.
Right.
Adults were jump roping. People came out of church and was in dresses jump roping. So it was a
Ah,
beautiful thing. So we're
yeah.
bringing all the activities that we've done in the past 4 years because we don't know if we're going to do this again next year. So we're
Why hold
it's going to
back?
be like fireworks. So
Right.
come on out September 7th. It's going to be big. You know,
Nice.
show up. Don't be left out. Sunday,
Excellent.
September 7th, 12 to 5. Thank
We'll
you.
get we'll get one of those flyers in the liner notes too. So thank you so much, Cindy.
Thank you.